is 0.24. Can I conceive naturally?
Yeah, definitely. If you don't have any other, that's what I told you earlier. Also, AMH doesn't mean that you're unable. AMH low AMH doesn't mean that you're unable to conceive naturally. If you don't have any other associated factors, like if you don't have any tubal problem, you don't have any fibroid, polyp, or endometriosis, and if your husband's semen parameter is normal, then you can definitely conceive normally, but only the chance of conception decreases when you compare to women who are younger with a good AMH value. But you should not get disheartened. You can try naturally. There is chances that you might conceive. One more thing is there are medication which can be given to you, which can increase the sensitivity of the follicles to produce eggs. And I would say in your situation, you're 31 years with the AMH of zero point 0.2, that compared to women who are 40 years and AMH of zero point 0.2, so you stand in a better chance, because as you age more and the AMH level falls, even not only the number of eggs goes down, even the quality of egg also is reduced. So if your tubes are okay, the semen parameter is okay, I think you can try for few more months to conceive naturally.
Right, but again, please set a timeline or parameters for yourself because we really don't want you to lose this precious time. So, doctor, we have another question related to PRP. So, let me share this. I did PRP treatment before IVF, but my IVF failed. So, should I do it again before my next IVF cycle?
I don't know what she means by IV. I mean, is it an endometrial PRP? Whether she was the braided rich plasma instilled into endometrium, that we need to look. And also we have to see whether there was an implantation failure, what she's talking about. So implantation failure could be to various reasons. That is, there should be an embryo and endometrial crosstalk. So there are various reasons for the failure of implantation. It could be the lining of the endometrium, antibodies in place. That's the reason the endometrium. So PRP may not be the only solution for such women. So we have to see, go back to history, go back to her the initial stages when the what endometrium was prepared. We have to look into all the medications and other reasons for her for the failed IVF. So if once time PRP is failed, I think it's the high chance that other doses again has failed, not repeating the same treatment again.
Dr. Vinuta, your network is really, uh, it's, your voice is not clear actually in between. I think some major network issues. So, uh, doctor,
Yeah.
usually when we have, there are conditions of low ovarian reserve, there are conditions when we are, nowadays we are saying that women in late 20s also are suffering from low AMH and all that. At times, doctor mentioned the statement that you are nearing menopause. So, what exactly it means, and the lady who is still planning her family, is it the alarming bell for her when doctor mentioned that you are nearing menopause?
So, I mean, we should know when in Indian women, menopause occurs around 51 years, and fertility potential will decrease about 5 to 10 years before she attains menopause. So, I mean, everywhere 35 is, I feel 35 is one, that is a magic number they have to keep in mind, and be more vigilant and take enough precautions, and also uh, think seriously about having a child.
So I think we can say that there are few factors which you should consider when you are planning your family. Low AMH, obviously, you need to think again and again, but please don't panic. There are many medical procedures, and we have very good fertility centers in our country where you can get your treatment, timely treatment, and do egg freezing or embryo freezing so that you can use those embryos or eggs when you really plan a family. Dr. Vinuta, I think now network is fine. Now I can
Yeah.
see you properly.
Yeah. Okay.
That's good. That's good. So I'll take few queries. Okay. Can we have green tea at the time of IVF injections? We have this query from
I don't
our.
think there is any contraindication to have green tea during IVF injection. As far as I know, green tea has some amount of caffeine. I think caffeine related some ingredient. I think that should not cause any problem. But only thing, anything should be in limitation. So don't overdo anything. Maybe 1 or 2 cups of green tea should be fine. So basically, they say it could be, it has some antioxidants. Fine, that should be fine.
So again, as the doctor suggested, don't overdo the things. That is really important. Doctor, we have one query from our YouTube user. Her age is 45.
Mhm.
Um, and now she has lost her child, and now she wants to go ahead with one more pregnancy, but doctor said that donor egg is the only possibility,
Mhm.
and she's saying that, asking that what could be the success rate with donor egg, and her husband reports is normal, that is 88 million count, and mortality is 80%.
So if she is opting for donor egg, I think the age of 46, usually after 45 years, almost your fertility career is almost nearing to end. So I think the best option is donor egg only. Yeah, the success rate is quite good because donors are the one who are not infertile. So we select donors who are fertile, and there are, according to the guidelines, there are certain rules and regulations how we select the donors. They should be between 25 to 35 years, and at least they should have had one children. That proves that they are fertile. So when the donor is selected cautiously and meticulously, and we do a day two scan to see how their reserve is. Depending on that donor, if the egg quality is very good, I think she has a good chance of having a good embryo and subsequently pregnancy.
Right. If you are planning your donor cycle, then we would suggest that please go ahead, and this time you may get success. Dr. Vinuta, we discussed about low AMH and we discussed about low ovarian reserve also. Any parting note for our viewers that how to deal with this age and fertility?
Yeah, so we talk so much about AMH. I think looking at the numbers, I think we should not panic. We should consult your fertility specialist. And I've seen many of them with zero point 0.1 AMH, they have conceived. So we are not gods. There is something beyond medicine also. Miracles can happen. So people should not panic, but at the same time, they should not take it easy also. So we should take right suggestion from the right people at the right time. Thank you.
Right, right. And I think this is really a nice parting note from Dr. Vinuta. Please don't hesitate to visit the good doctor at right time, right age. And viewers, if you are from Bangalore, in and around Bangalore, please do visit Kushi Fertility and seek your treatment options from there. We have very good success rate from Kushi Fertility Center, and this whole session we Kushi Fertility Center is contributing a lot, we can say, in fertility area, because they are using new technologies and new procedures, and again the staff is really friendly. And uh, from I think we yes, we have taken up the queries. So thank you, Dr. Vinita. Thank you so much for joining us today. There was some network issues in between,
Yeah,
but again, we have completed the session
yeah.
successfully. Thank you,
Thank you
Dr.
so
Sir.
much. Yeah, thank you so much. It was nice interacting with you. Thank you once again.
Thank you, ma'am. So, viewers, tomorrow we have a very interesting meditation session. Please do join a Zoom session at 6:30 to 7:30. Tomorrow we have Guru Purnima. On this occasion, we emphasize on doing meditation, positive manifestations with your partner. So please join. It's a Zoom session. Just inquire on our social media, यूट्यूब पे या आप इंस्टा पे फेसबुक पे कहीं पे भी यू कैन सी द होल क्रिएटिव ऑफ टुमारो सेशन टू join and do the meditation with our expert, and yes, take the blessings of full moon night. Thank you, viewers. Thank you so much for joining today's session. Thank you. Have a nice day.